Thanks, Mo. Well, February is American Heart Month. It's also Black History Month. And we have one story that tackles both topics. In Eye on Health, Latrice Curry explains why there is a disparity in care and outcome when it comes to minority patients.
Minority patients who suffer from heart disease are more likely not to receive early intervention and to have a worse outcome compared with others.
And there's no doubt about it that there are significant disparities in health outcomes. Even when we control for things like access to care, that is, when everyone has insurance.
Research shows adults who are Black or from other underrepresented racial or ethnic groups receive up to 10% fewer early treatments. Black patients had longer hospital stays and fewer discharges home. Hispanics, Asians, and Native Americans all had higher in-hospital death rates than white patients.
Well, I think the prolonged stay has to do with the degree of the illness when they present. So a lot of this, unfortunately, the underserved population, by the time they do get to the hospital, their condition is a little more extreme because they haven't had some of the necessary early care.
Dr. Golding says to turn this around, it all starts with education, overcoming fears and stigmas, and making sure everyone has access to quality health care and treatment.
So I think if we can get to them earlier, as far as education about preventative things and how to better take care of themselves so that when they do present with some of these more complex problems, their overall conditioning and comorbidities aren't as bad.
Dr. Colwright says racial and gender concordance also makes a difference. It's important for patients to see medical professionals who look like them.
What that means is when you go to the doctor, does your doctor look like you? Are they from the same community that you are?
Though the pandemic has hampered their efforts, Dr. Golding says it's important to get out in the community and try to reach young people to help them form good habits.
If we can catch people earlier, and we haven't really considered this, but maybe we could get into the high school levels, and that's kind of where some of these habits get started.